Morning from Circuit World. Oh, BKP's over here on his cell phone. This is Ask the Doc portion of our program this morning. And BKP, how you doing this morning?
Well, I know, Dr. Whaley, you have run those marathons, and boy, do you know when the gun goes off how to jump out first.
Yeah, just trying to help you, you know.
That is great.
What's this for? What's my tie? Hey, what's my tie for, Lonnie?
International NATO meeting?
Yes, okay,
right.
Let's get on it.
All
NATO.
Right,
All right, my man went over there and he stood up for America and he didn't pay a bit of attention to naysayers. And that press conference he had with Mrs. Merkel, I mean, she said 7 words, I think, during the whole thing. Anyway, so enough of that. We'll leave that to the expert panel. But I'm wearing this for you, Mr. Trump. You're still standing up there and doing my job.
My president does an outstanding job when he's abroad representing the American people, not Washington, D.C. Okay, moving right along, because you know I'll get stuck.
I got another one. Jeremy.
Yes, sir.
All right. There's an 80-inch television right there. 82, it's whatever, it's huge, it's so big, it should be on the wall of a bar, but it says Black Friday only, and that was Friday. Is that price still good this week?
Sure.
Sure.
Put me on the spot.
Put him right on the spot. Jeremy says sure.
Well, but look at the thing. I mean, it's past Black Friday.
No, I try not to look at it.
I mean, folks, if you want a big television set, Jeremy's got one over here, and he'll give it to you for last Friday's price. If
That's
you get
as big as the movie screen.
It's as big as a movie. As big as the movie screens were when we were kids.
Exactly.
And you can have that price for till tomorrow night. Close of business Saturday. All right, let's go to work.
Dr. Whaley making deals. I
used to work.
You got anything else?
No, but you remember I went to work when I was 8.5 years old.
I mean, he's opening the segment. He's selling over here.
All right,
but we are going to get to questions. It's time for Ask the Doc with Dr. William Whaley. And we want to thank North Georgia Cancer Research Center, affiliated with Northside Hospital. We thank you so much for this segment. Dr. Whaley, we're going to jump right into the first question. I have 6 brothers and sisters between 57 and 40 years old, and none of them will get immunizations. Go to the doctor for a checkup or test. Non-smoker. What are the chances that any of them could get cancer, and what do you recommend I say to them? My primary care doctor does mammograms, and I had a colonoscopy when I turned 50, but they laugh at me. They all have businesses and jobs and insurance, so that is not a reason. So I guess we have a question here from a sibling that says, I'm trying to help my family members, 6 brothers and sisters, take their health more serious as they age, and they just laugh at me. And I will say that I want to add this little thing on here. The other day I saw something on the internet that said when you turn 50, your check engine light comes on.
Yeah.
So that I just saw
that's a real good segue into what we really have here. Well, I think we're going to have to say this is a female.
Okay.
Because she said my primary care doctor does mammograms. I think that means she had one, and that she had a colonoscopy when she turned 50. So she's doing her job.
All right.
Now, she's got these siblings that are not unlike some of the people on your expert panel who don't get immunizations, and we're not doing immunizations today, and so we won't bring that up. But not taking a flu shot because you don't believe in it is a lot different than not doing a mammogram or a colonoscopy or whatever. So, interestingly enough, the age range, let me put that first thing up there that's that graph. I shouldn't be in a graph. It sounds like I don't know what I'm talking about. Take a quick look at this. You need your glasses here at BKP. This is the incidence. Watch this, everybody. You see how this thing rises like a rocket. What's this age right here where this thing starts to going up?
40 to 44, 45 to 49, and it really takes off north, like I said, from 50 to 54.
Yeah, that's right. The check engine light went on.
Yeah.
All right, so the age range she's talking about here is that age range of the rapid increase in cancer. So now they may have had their head in the sand down here, below the age of 40, let's say. We'll leave it at 40. and they didn't go get their regular eye care because they haven't reached the point where they weren't able to read you can pull that down, Lonnie. They didn't get to the point, at about age 40 or 41 or 42, you start doing this, right? So wait a minute, something's going on. I need to go get some cheaters at Walmart or whatever. So below the age of 40, you can understand why people may not have done some tests. We'll come back to that again in a minute. But once you hit 40, or as you say, 50, your check engine light comes on, and you'll see there's a question in here about whether it's 40 or 50 about the check engine light. All right, well, let's go to that next one, Lonnie. So cancer, you got everything from your hairline to your toes, and there's all kinds of different cancers. So what kind of cancers? You got males and females in this group right here.
Right.
Now, get your glasses back on. But if you'll notice, the top cancers, and it's just from here up, these are obviously the top cancers. That's top cancer deaths. That's new cases. The cure rate's such that the incidence of new cancer cases per year now, that's breast, prostate, lung, colon, well, that's all of them, and they're males and females. The death rates are a little bit different. You'll know the lung cancer death rate's at the top, whereas it's the third in incidence, just because lung cancer is a little harder to treat. But that four, colon, rectum, lung and bronchus, prostate and breast, that's the sort of thing that people generally get screened for in the recommended screening programs that a family practitioner, if a woman goes to a gynecologist or whatever, would be screened for. Lonnie, put that next one up there.
Those are the top 4 new cases.
Correct.
Yearly.
And
those are the 4 that you should screen for.
That there are very strong recommendations about how you screen for.
Right, okay.
All right, show this next one. You didn't think this was the flu one that I had up here a week or two ago. Remember that?
And let me ask you a question. Yeah. I don't want to say simple. I don't want to ever use the word simple here, but the screening for those 4, it's not real hard when you go to a doctor to have those areas checked and that screening done.
No, the colonoscopy is a little bit of a thing, but that's also every 10 years, so it's not a big deal. Well, here's this. We always have a map of incidents, right? We had the flu map up here a week or two ago, and this dark color right there is the highest incidences of cancer in the country by state. If you look at it, interesting, you've got Louisiana down there where there's all those oil refineries. Then you've got the Rust Belt states where there's all that industry. But you would think that in the South, where there's not much industry, it might not be too big. But Georgia's cancer incidence is the second highest rate that there is in terms of color. So we're talking about Georgia. All right, pull that off, Ron. So in a geographical thing, I don't know whether this question was written in China or written in Massachusetts, but if it came from Georgia or one of those big old Rust Belt states where everybody lives, it's a little more important there than it might be if you lived in Hawaii, where your cancer incidences from things that go on around you is not quite as high. All right, so this next one, you got the cancer checklist up there. The one about the aortic aneurysm and all that sort of stuff. All right, so wait a minute. We got to go back here for another. Hold on here, BKP. I'm going to do one of your things here. All right. Now, I said we would get into other things, like you get the glasses and everything. So this is a Ray Tidman type group here that's about everything that somebody really ought to be getting screened for. And I was talking about age. When we get to the news of the week, it's going to talk about cholesterol in young people like in the 20s. But I'm going to make the assumption that you got to 40 years old and you haven't done anything. So prostate cancer screening, colorectal cancer screening, breast cancer screening, all of those things begin with different recommendations at about the age of 40. I'll throw this in for Ray Tidman, and that is that if you're going to your family practitioner for the first time at age 40, he's going to do an A1C test or some sort of a diabetic test. He's certainly going to take your blood pressure, and he's certainly going to take your cholesterol level, right? Okay, so pull that one down, and we'll go to that next one that's kind of complicated. Well, I'm having a hard time here with this technology myself. Come on. Now, you got this big fancy woman in here. This tells you that there are different people recommending things. So let's go to mammography, and that's the simplest one, and we'll use it for a guide. It says here that the American Cancer Society recommends starting at age 40 with a mammogram. The U.S. Preventive Services Task Force recommends 50. Then one of them says do it every year. One of them says do it every 2 years. We're not here to argue the frequency at which these tests ought to be done. We'll let the insurance companies say I won't pay for it except at this interval or whatever. But clearly, a female at some point needs a family history taken. If there is breast cancer or ovarian cancer in the family, then you would go to that early screening, get that mammogram at age 40. Now, we're men here, so prostate cancer screening with the PSA and the digital rectal is recommended to begin at age 50. But if you're an African American, if your dad or your brother had prostate cancer, you got to start that 10 years early. Colon cancer is pretty clear. Everybody recommends it at age 50, unless you're in a family like your expert panel member who's got 11 people at our mother's generation and 5 have had colon cancer. They need to do that first one probably at age 40. And when you had your colonoscopy, right? And if it was normal, what'd they tell you? Come back in 10 years, right?
Yes.
10 years, right? That's what they told you when you had your colonoscopy. All right. So basically, what do I recommend that you tell them? 1, do they wear their seat belt and their shoulder harness? Why do I ask that?
Because if you wear that, you're concerned about your safety. You're concerned about the possibility of having an accident.
But you don't plan to have one today, do you?
Right. Exactly. You wear it not intending to have an accident, not thinking you would have it. You wear it for a precaution.
That's right. But you know that the statistical chances that you will have a better outcome are if you wear the belt.
Absolutely. Your chance of survival is better if you wear the belt.
Lonnie, there are 3 men sitting in this little circle here. Statistically, what is the chance that an American will get cancer? What proportion of the... One of 3, correct. 1 of 3. Now, what's the chances that we are going to have a near-fatal automobile accident?
2.
No. In our lifetime, the chances that we will have a near-fatal automobile accident are 2%. We're wearing a seatbelt.
To prevent a 2% chance, but we're not going and getting checked out
for
in a 33
in a 30% chance.
Anyways.
So that's
I have to tell you, I know you always answer the questions. You do very thoroughly, and I was waiting to see how you brought that around to her talking to the family. And I love that. No,
well, that's
because that's what she really wants to know.
What do you want to know?
Right.
So good. So here's what you tell them. We're wearing our seatbelt. We're driving safely. We're not speeding. But our chances of being in a near-fatal accident are less than 2%. Now, we're going to have fender benders and stuff, but I mean a really big-time car wreck. But the chances that are there 6 of them here?
6, yes.
2 of them are going to have cancer. Which 2? I saw a patient this week.
And if one of the 2 is the sister that wrote the question that is doing all the screening, she will stand a better chance of surviving out of the 2.
Correct, absolutely.
Because right?
That's right.
Okay.
I saw a patient yesterday who was 62 years old, in great health, was an exerciser, ate all natural organic foods, has never had a drop of alcohol, never had a cigarette, is not in a family where people smoke around them, who went to the emergency room on Thanksgiving Day with a bellyache 2 hours after the Thanksgiving meal, thinking they were having gallbladder issues from a great big meal. Did an ultrasound, had a malignancy in the liver, chest x-ray, had a malignancy in the lung, and has colon cancer that would have been detected in a curable stage if they had done a colonoscopy at age 50. This patient's decade beyond that would have cured him. And that's a sad situation when somebody says, well, I just didn't do it. They were insured. It wasn't that they had to go out and pay for it. It wasn't. So that's the family she's got. They're insured. They've got jobs. They may be busy. I don't know what they are, but sit down with them at Christmas and talk to them. Good enough?
Very. I mean, that was a good answer. Like I said, I was listening to everything, and I was wondering because a lot of times it's very hard, regardless of subject, to talk to your family about things.
Yeah.
And you brought that around. That was a very good answer on
I'm
how
going to make a real quick suggestion. One, the females in that family, at least when they're in this age group, need to go have a pelvic exam by a gynecologist or a family practitioner to check them for cervix cancer, even though that's not on that big list, all right? And then that other stuff, I'll hit on one more. PSAs, colonoscopies, and mammograms. Now, the other one up there was lung cancer. There is an inexpensive test that Medicare and all insurance is obligated to pay for called a low-dose spiral CT scan of the chest. So if these people don't smoke, but if any of the rest of the audience have people in their family that have smoked as many as 30 pack years, that means a half a pack a day for 60 years, or 2 packs a day for 15, and are over the age of 50, their chances of lung cancer are very high. And you saw that the death rate with lung cancer was here and the incidence rate was there. So if you get lung cancer, we don't do as good a job about curing it as we do with others. So you want to diagnose it early, and that's the only way to diagnose it early.
Folks, don't forget, you can ask Dr. Whaley a question by sending it to info@fetchyournews.com. Put it in the subject line, Ask the Doc. Also, follow our social media page, Instagram also, and Twitter, Fetch Your News. And that's where we always are blasting out throughout the week segments about Ask the Doc. And you can put your question there. But again, the more detail, the better the answer. Pretty simple. I like you.
Yeah, well, I tell you, I think the first one was really well written.
Yes, it was. Okay, let's get to the second one. This involves a husband.
No, this is a follow-up question from 2 weeks ago or 3 weeks ago, if you'll remember.
My husband has multiple myeloma.
That's it, yeah.
And has gone into remission with chemotherapy, and now they are talking about a stem cell transplant. Is this wise?
That's a big question, isn't it?
Yeah.
You remember the discussion we had here a couple of weeks ago? It was about monoclonal gammopathy of uncertain significance, and that's present in 5% of the normal population. And if you remember, we said then only a small percentage, 1 or 1.5% of those people will progress into multiple myeloma over the rest of their life. So don't panic if you have monoclonal gammopathy. And then I said at that time, there are good treatments for myeloma. And somebody picked up on that and asked this question. The idea of a stem cell transplant, I want to stick a minute to that. If you turn on the television today, cable programs, and watch the ads, there are all of these ads in there for stem cell clinics. And for back, I had chronic back pain, and they told me I'd have to have an operation, and I was going to be in a wheelchair within a year. But I went to Joe McGillicuddy's stem cell clinic, and I had a stem cell transplant, and now I'm playing golf again. You hear those? Or I had stem cell transplant in my knee, and they were going to give me a knee replacement. Now I'm getting ready to run a marathon. Well, that's all baloney. You don't believe me, do you?
No, I'm listening.
Okay, all right, but
I'm
we
listening.
talked about it before. That's everybody wants to jump on the bandwagon of stem cells. That's not what stem cell transplant is. There is no statistical information to say that stem cells used in that fashion are of any benefit at all. And lastly, insurance companies wouldn't come close to paying for it. So that pretty much tells you it doesn't work. And insurance companies 100% pay for stem cell transplantation in multiple myeloma patients at an appropriate point in time. So the question that she asks is this wise? That really is this wise at this time in my brother? Because stem cell transplant is an integral part of the curative intent treatment for multiple myeloma. Put up that first sign there. So this just gets you freshed up. We're talking about stem cells. We're talking about multiple myeloma, and the fact that the patient got into a remission and they're talking about stem cell transplant is all good. That means they're going farther along trying to cure the patient. You'll remember we've had discussion about lymphoma, and
Right.
if a PET scan shows that it's gone after 3 or 4 cycles, you give more in an effort to cure.
Prevent it from returning.
Yes, okay,
Right.
that's it.
Prevent it from coming
He
back.
didn't-
There's part 1 to get rid of it, and part 2, I'm
Right.
calling it, to prevent
That's
it.
right. Pull that off the screen a minute. See,
All right.
now he didn't look at all these things and do his homework, but he just got that one right.
Yeah.
So this goes.
You don't have to tell everybody I didn't do my
Okay.
Teachers for years said I didn't do my homework.
All right.
I don't need you to tell.
All right. So basically, you just got it though.
Right. I'm
To
listening. Got
prevent
it. Right.
it from recurring. All right. Show that next one.
Because I'm reading this and I'm reading it in a timeline. They went through chemotherapy. It was diagnosed. The diagnosis, they said, okay, we're going to start with chemotherapy. It's gone into remission. So I'm reading it because of a current situation. I'm hearing, although it's not the same, the timeline that they're at.
Correct.
Am I right?
That would be like in
Okay.
lymphoma, the PET
Right.
scan being normal after a certain amount of treatment. Or in colon cancer treatment, where you have done the chemotherapy and then the hole in the liver has gone away, you don't stop. You go in there then and operate and take
Right.
out that place. All right, so this graph right here shows the survival after transplantation. It's a decade ago,
Right.
but you'll notice there's a bunch of different types of transplantation here. So Lonnie, that just shows people that there's different lines there, right? Everybody's used to the line, well, the top line's the one you want to be in, right? The one with the longest survival. So we'll just go back. We're going to do a quick update of what we did 3 weeks ago. Put up that bone. You got the bone up there? All right. I showed a bunch of bones with holes in it when we were here a couple of weeks ago. So what this means is this patient's gone into a remission, and all of these cells are gone when they do a bone marrow, and all of these proteins in the blood are gone. All right. Now, it's not hard when you think about, imagine a big soup bone cut in half, all that red and yellow marrow in there. It's kind of stuck to the walls, isn't it?
Right.
I use this, pull that one down, Lonnie. I use this analogy a lot. If you have a freestone peach and you break it open, there's still a little tiny bit of peach in that seed, right? I mean, even though it's a clean pull away. So that's what they're trying to do, is get to that little bit of seed that's left on that breakstone
Right.
peach. All right, show that one with that guy lying down there. Now, there's nothing to be afraid about with stem cell transplant. This will tell you, there's a bunch of different things here. One, the old style bone marrow transplant, and still used in leukemics, is where you've got to have a brother or a sister or some random person that you find off of the international registry that is a match. That's a tiny slice of stem cell transplants today. most of what the stem cell transplant today is your own stem cell. So what they do here, we know that this guy, myeloma guy, so here's our myeloma man sitting over here. We know that he doesn't have any significant detectable tumor in his blood or in his bone marrow. That doesn't mean there's not a few cells hiding somewhere. So what they do is they give him those drugs to raise his blood count really high. Those are stem cells. They take them out, they put them in a freezer, and then they give him a lot of chemotherapy, enough to kill everything in the bone marrow. That's a slice of a few days. And then once his bone marrow is totally dead, they go to the freezer and give him the stuff back, and it generally takes less than 7 to 14 days for that stuff to start growing. So pull that one down there, Lonnie. So the last one, put the last one up. It's titled Timing of Stem Cell Transplant. And the only place that there is any debate in whether or not a stem cell transplant is indicated is whether it is done right now when that patient was diagnosed and put into a remission for the first time, or whether he begins some maintenance program and then relapses a year, 2 or 3 years later, and then is transplanted. Well, at Northside Cancer Center, our bone marrow transplant program has the highest survival rates in the world. And they are very big in myeloma stem cell transplant. And they did tons of research along with other transplant centers all over the world. And what they did was they transplanted some people after relapse. They transplanted some people and they went into the first remission. You can pull that down, Lonnie. And basically the program today, if you're good health like you and me, or this guy seems to be, in his first remission, stem cell transplantation is the place to do it. So I'm going to say, assuming that he is in a high quality university program, and there's dozens of them across the United States, those people are specialists in myeloma, and if they're talking stem cell transplant now, it is a good sign. It means they're trying to cure him. It means that he's strong enough to go through it, and I would therefore say, yes, it is wise.
Well, being in the room and my family being in the room with a cancer patient and hearing a doctor, these are my words, say, an oncologist say, this is where we're at, this is what we need to do now. I actually understood that question in a different way this morning, and I see what you're saying, and I can actually hear this is where we're at, now this is what we got to do. Because sometimes it depends on what kind of cancer you have. Sometimes,
correct. Oh, yeah.
Sometimes if you have, what was the other cancer I'm looking for?
Melanoma?
Yeah. Or what's the other one I'm looking for? Anyhow, huh? Yeah. Anyhow, like you get to a point and you're in remission. Now they might want to start radiation on the area where the tumor
correct.
was. Right.
That's correct. Absolutely.
So when I see this kind of cancer, the doctor's saying this is where we're at now, and I'm not trying to associate the two, but
no, but you're
understand
exactly right.
what I'm saying.
It's exactly the same concept. You have reached a place where you have control, and what you're trying to do next, the radiation where it was, not where it was at,
right?
Where it was, is to prevent it from recurring.
Right, exactly.
Period. So the next step is always a good step because it says we've gotten to a point we want to be in. And if we do this, it improves your chances of long-term survival.
Folks, great questions this morning. Really enjoy them. And I'll tell you how you get a question to Dr. Whaley. info@fetchernews.com or on our social media page, Fetcher News, Facebook, and Instagram, Twitter. But you could send Ask the Doc, put in the subject line there, info@fetchernews.com. Great questions. Today's news in the medical world.
Well, I know that I could hear the expert panel over there chirping, so we're not going to spend a lot of time at this, but you heard it here first. Distracted by their smartphones, pedestrians are landing in the ER. 76,000 people. How many of those died? We're not going to go into that. Vaping illnesses are now seen to be the same as what was present in metal workers. We're not going into vaping either, but you heard it here first. You know, first of all, they didn't know what the lung disease was. Now, under the microscope, it's the same thing as people who used to have cobalt lung working in mineral mines.
And they're doing that research because we just had a lung transplant not long ago.
Oh, yeah, there've been more than one now.
Due to vaping.
Right.
Okay.
But we're going to get down to this one because everybody keeps talking about this low-dose aspirin thing. You remember a month or two ago, this thing came out and said low-dose aspirin for people who do not have specific high risk, smoking, high cholesterol, whatever, has not been proven to diminish the chances of heart attack. And when I think it was Rick Gluckert that brought that up to me. What do you have to say about that? I said, well, that says it hasn't been proven to diminish it, but it hasn't been shown that it harms you at all. But there's other things that aspirin could do for you. So this particular article came out yesterday, and the title says,
Low-dose aspirin might cut cancer risk.
all right, now you saw how high the incidence rate was for colon cancer
Right.
in that thing. It was number 2. Low-dose aspirin can drop the colon cancer rate by 34%. That's a huge number. If 1 out of every 10 of us are supposed to get colon cancer, you drop a third, that's huge. Now, you got all the discussion about pancreatic cancer with all GI cancers, so that's esophagus, stomach, pancreas, are dropped by 28%. That's not even colon. So that baby aspirin may not prevent the person that doesn't have major cardiac issues from having a heart attack, but that's other stuff that it does. Now, interestingly, it works better to prevent cancer in people who are overweight. Now, I haven't the foggiest idea why that is, and they didn't either, but they get an extra 19% kick compared, if you just get all cancers and you got people that are at ideal body weight versus those that are moderately obese or higher, the benefit was a little bit higher in that group than it was in the other group for reasons that are not clear to me. So there's the news.
Well, I take my daily low-dose aspirin. I take my daily allergy pill.
And you take your protein drink,
I do
and
my
you've never had a drop of alcohol, and your
I-
colonoscopy was normal.
4 out of 5 ain't bad. Well, not that it wasn't normal, but we'll touch on that later. Look, we want to thank Dr. William Whaley every Friday morning for this segment. And if these questions, the answers apply to you or a friend or someone in your family you want to share them with, you could always go to our YouTube channel, FYN TV, Fetch Your News YouTube channel. Subscribe, and every time we put up something new or we're live there, you will get a notification. Look for the playlist. Just click on playlist, click on Ask the Doc, and all of these videos are there stacked together, and you could share these with family and friends because it's great information. I want to thank you for your questions, as always. And don't forget, you can ask Dr. William Whaley a question on social media, fetchyournews.com. Facebook page, Instagram, and Twitter, and also send it to us at info@fetchyournews.com. Put in the subject line, Ask the Doc. We want to thank North Georgia Cancer Specialist, Research Specialist, affiliated with Northside Hospital. So we thank Northside Hospital so much for this segment. And you have a nice day with your international tie. And
Thank you, Mr. President.
and go do what you can to heal people. We appreciate you very much. Next up, the All-Star Political Panel. I know you want me to come up with something new, but I always say, I wonder if they have anything to talk about. They're here, they're ready, and we got a lot going on the other side of this break. Thank you, sir. Have a nice day. Take us a break.